Yeah, so welcome to today's discussion on the case analysis of Field of Dreams. So where would the group like to start? We're going to focus.
An easy place to start is if you willed it, he will come.
So Ray, all right. So now, in the opening monologue, maybe a different choice of words in a clinical setting, but he tells us that he's never done a crazy thing his entire life until he heard the voice. So I'm going to take that as evidence of, or at least self-report, that there does not appear to be any past psychiatric history. Right now, I think as a clinician, we would want to verify and ask more questions, but at least at first glance, it looks like we are seeing the onset of a disorder with no prior psychiatric history. And are we okay in arriving at the conclusion that what Ray experiences appears to be an auditory hallucination? All right. So, all right. What else?
I thought that what was very present in the film was like the concept of and I can't pronounce this, but the Bolia layer but I just thought that was very obviously permeated the entire film. And it was very interesting that it kind of, the more people or characters that came in, like it would be passed on to them.
His wife first,
Yeah, his wife first, then
daughter, which makes sense. It may have been a little bit more medically accurate if it was the daughter first, then wife, but I think we might be getting a little nitpicky there. And then those outside the home, those that would have less frequent contact with Ray. So for the most part, the dynamic does make sense.
I almost wonder if, in that vein, if there is like I don't know how to take this movie, so I'm gonna.
But that's why you're here.
But like, if everyone else is also hearing this auditory hallucination, like all of the cars that come, like then I'm thinking like a mass substance induced or mass like environmental exposure leading to the same auditory hallucination would be strange, but that's kind of where my mind went.
Right. And as a clinician, it has to go there because irrespective of what we think is going on from a provisional diagnosis, the clinician will always need to investigate the potential role of substances as well as underlying medical conditions. So it is clinically adept and accurate to do just that.
So I was wondering actually, because they brought up the idea of like the 60s a lot. So they talk about all of the characters that, they were part of the 60s. So I was wondering if when we're talking about, substance-induced psychosis, if this was a leftover, from potentially all like the LSD that was taken. And then now it's kind of manifesting as these symptoms because while it did occur in the child, I think it was primarily in that age group that would have been like very active in that scene in the 60s. And so I think that that's an idea for where the psychosis came from in such a mass effect.
Well, before I actually ask the question of related to your comment and your observation, in terms of the next step and the clinician investigating the potential role of substances, we're going to identify the auditory hallucination as a psychotic process and therefore have to discuss the substance-induced psychotic disorders. So what 5 or 6 substances would we need to investigate if we had Ray Kinsella in this room right now? Might we ask specifically if he used or is using currently?
Vitamins.
Got it, right? So from that perspective, is there anything there? Because again, clinically, you just named, rattle off of 5 substances that can induce psychosis. Now let's fold in your observation about their, including Ray, being a product of the 60s. And that's an illusion that's made by Ray himself, right? And I even think, I'll have to look at the script, smoke some weed is actually in the script, right? So, I'm not so sure we can easily dismiss that Field of Dreams is a fictional case of a substance-induced psychotic disorder. Now, we have to discuss further, which we won't, because we're not going to discuss children or adolescents, but how is it Karen? And again, that might be through the dynamic of shared psychotic disorder. So we may have a dynamic that explains how the child comes to believe and experience their parents' delusions. All right. Is there further evidence that LSD is the culprit here?
I feel like in the running the scene, if I say it, they're like in the school where they're talking about the books that are like off of it. I feel like there potentially was a mention of LSD, but I can't quite remember.
I think he actually denies use,
Does he?
Yeah.
Okay.
which unfortunately has little to no negative predictive value in a clinical setting, right? The only value is when a patient endorses use. So there's nothing we can use. That information is useless in terms of diagnostic value, unfortunately. I think the clinician must still maintain that high clinical index of suspicion despite the patient's report.
At the beginning of the movie, he talks about experiencing the 60s. So like, yes, he might say, okay, I didn't do LSD, but
Yeah, we do have to keep it up, I think, in a differential. The other part of this too, and I'm not a farmer. Anybody here have a background? No?
Gardening. but-
Gardening? Well, we'll ask you that. I know that ergot, which is structurally similar to LSD, grows on wheat and rye. Does it grow on corn? Is that a no? Or yeah?
I'm not, that we garden tomatoes.
I just wonder, this being set to a cornfield, was the writer director just tipping us off that maybe LSD?
Also, if we're talking about like mass or like several people, and this is a farmland type space, like what's the chance that everyone in the town, including the child, has like actively used like a, like a substance for or like LSD versus it being some kind of core accidental like
Right.
exposure or whatever.
Yeah, man, again,
Google search. It does not infect.
it does not affect corn. There goes that theory. Yeah,
It could be on other farms. I mean, I don't know. I
That's
don't know
true.
farms, but if farmland is
So,
expensive.
I'm going to ask a typical New Jerseyan question, and if you have your search engine up, I have to actually say it with a straight face. Are there wheat farms in Iowa?
Yeah, I'm kind of wondering if farmland can be used for, or if it's just all corn.
I think it's primarily corn. But like, I mean, people don't.
Again, it's a typical New Jerseyan would think Nebraska and corn just because of what we learned through college football.
There's
Being
also farm
being
supply.
incredibly ignorant.
There's a feeder's grain and farm supply.
So again, let's just tuck this in the back recesses of our brain for now. Any other evidence of substance use from that list that can induce psychosis? So again, cannabis and LSD / hallucinogens remain the top of our list. All right. Any other observations here? Focusing our clinical attention on Ray Kinsella.
All one big hallucination.
Any other?
I had a theory that
Let's hear
I
it.
proposed in our room, that this was almost like an end of life hallucination, like looking back on things that he regretted. And like as he is, like this is his way of coming to terms with both he himself passing and a great regret that he had. Like not being able to, that was my thought, like, could this all be, we're seeing his thought processes as he's experiencing some sort of medical process.
Well, maybe not evidence, but like one thing that goes along with that theme is the beginning is kind of him narrating his entire life, which I don't think is like a typical thing that people do just regularly. Like that could be just gonna continue to be that, he's narrating his life, if we highlight everything that he is, and other stuff, but.
So I'm going to assume with the opening monologue and his doing just that, that theory didn't pop in your head that early. So can I ask when around a particular scene, maybe a part of the movie where you began to adopt that theory?
For me, it was just like when the cars are coming at the end,
Oh, so it's towards the end. right.
at least for me, like.
Anyone else? Anyone else? A, share the theory, and B, have a point in this movie earlier than the ending scene.
Also the whole ending scene, like his dad.
Right. Mhm.
Like all of that. Maybe in retrospect, now that I'm thinking about it, but when I was like watching the movie, I was like, I wasn't thinking about that.
That's how I felt too, and I feel like too, sometimes people who like are close to passing, and don't fully pass over, talk about seeing loved ones. Or seeing people who have passed on the other side, so now you have all this field of like, all these people who have passed on, and his father is there too, so I feel like it's kind of their area of like, being close to death.
And when he first meets his father, the New York Yankee asks, "Is this heaven?" Right, doesn't he? Where, and that prompts the tagline, it's Iowa. But nonetheless, so the idea is proposed.
When I watched it, I was thinking like, is this an MDD with psychotic features? Because just with everything that's happened in his life, he's in Iowa or someplace he didn't want to be, he's being a farmer. Is that what's manifesting, or is this the entire thing, the product of like some type of schizophrenia type diagnosis that obviously isn't really shared, but it's just completely all a hallucination.
Product of his own mind. Yeah, and I think again, as a clinician, we have to go there right after, immediately after investigating the potential role of substances. Because the DSM and the American Psychiatric Association stipulates that we have to investigate the role of a mood disorder, and specifically a mood disorder with psychotic features. And given the reveal at the end, ease his pain. We have to consider that this may be a primary mood disorder. Right, so maybe a primary mood disorder that goes untreated. There's no evidence in this movie, at least early on, that he was treated prior to middle age. We don't get that information. And then major depression can not only become chronic, but it could also become chronic and severe. And in its most severe form, can incorporate psychotic features as evidenced by hearing a voice. So there's a timeline here, right? And somewhere within this timeline is this, and we've talked about this condition once or twice before, but we need to bring it up again here, persisting complex bereavement disorder, where after quote unquote normal bereavement, which is the normal grief reaction, normal in that it does not impair functioning. The individual can actually have a prolonged or protracted grief reaction clinically once the individual does experience clinical distress, is labeled or termed persisting complex bereavement disorder. So that likely plays a role here as a bridge over to a major depressive episode, which then probably becomes chronic and persisting. Largely due to lack of social support, again, moving away from his home and family, as well as increased stress. By the way, the bank's about to foreclose. As well as other factors, lending to chronicity.
Did anyone else think there was like potentially some sort of psychiatric history of the father based on like throughout the story?
No, but I think there's dialogue, which I think a normal person would hear, not think much about, but maybe in groups like this, we can maybe overanalyze for the sake of making a teaching point. And that is when I think Ray is talking to Terrence Mann. And Mann is questioning, inquiring, why is it that you never spoke to your dad again? Remember that dialogue, that conversation? Do you recall what Ray reveals in that self-report?
I remember him saying like he said something cruel and he was like, then he was asked like, why did you say? Because I was 17.
Exactly right. Now, again, I think at first glance, teenagers being teenagers, perfectly reasonable to have that interaction with mom or dad. However, in the context of what we are now seeing and have the benefit of retrospectively looking back, this may not be simply attributed to teenage angst. There may be something more there. And what mood disorder, because we're talking about mood disorders, likely has its onset at age 17 with irritability
Depression.
or
Schizophrenia.
mood disorder,
Anxiety.
mood disorder.
Schizophrenia.
Say louder. Bipolar. Bipolar, the cardinal feature is an elevated, expansive, or irritable mood. And that was an irritable mood in which he told his father what he said. Now, again, I was 17. That's how he attributes it. And I think that's how 99.9% of the viewership of Field of Dreams should view it.
Could have been manic.
He could have, that absolutely could have been, especially in light of what we see here.
Yeah, I feel like if you just heard, let's say, a patient went out in the field and started making a baseball field, that kind of like energy, the drive that would take, like mowing down all the corn and stuff like that, that could be like,
Very.
yeah, that's
Yes,
like manic.
It
behavior.
absolutely is.
Yeah.
It's impulsive,
Yeah.
it's increased goal-directed activity, and with evidence of psychosis, which up to 50% of individuals with established bipolar will experience, which is more than double that of people with, or individuals stricken with depression, which is more along 10 to 20%.
I thought the wife almost exhibited more manic behavior than he did, like with the meeting at the school. And after, I think when we think about manic behavior, yes, he was very manic, but he didn't have like the pressured speech, the wild energy. He just had this kind of slightly irrational goal of making a baseball field and did it. But the wife exhibited very manic behavior. She was very high energy, very pressured speech, disorganized thought, impulsive. And I don't know if that's like just the part of the shared and psychotic.
I like that idea, and I would love to have observed Mrs. Kinsella when Ray is in Boston and then Minnesota. Because when he leaves the state, and by the way, when he leaves and it tells her that he's leaving, she's rational. Excuse me, sir, the bank's about to foreclose. So yet he goes where he feels he needs to go. There's ideas of reference here. I mean, he sees something written on paper and decides, well, that means I have to drive to Boston. I have to find Terrence Mann. It all makes sense now. So my gut would say that if we were to build a YouTube video, film short of just her while he is in Boston and then Minnesota, she would be perfectly normal, right? I mean, I think she's got a 7-year-old to take care of, but beyond that, she might actually escape any kind of diagnosis of mental illness. It's just a gut. So what's going on with him? So we think he might be bipolar, and Field of Dreams, maybe that is the film, maybe a fictional case of a manic episode, right? And mania with psychotic features. And if we're entertaining this thought, then schizophrenia, new onset, which again, middle age is less likely anyway, atypical in onset, is going to be pushed lower in a differential now. Now, this doesn't necessarily dismiss the role of substances, because we know that the substance use in bipolar is the highest among any other mental disorder. So this only kind of strengthens, I think, our provisional diagnosis, whether or not cannabis or a hallucinogen is involved. And then taken together, the pending foreclosure is timely here, because with him acting impulsively and with the bank having to now move in, his perceptual disturbances actually progress from auditory to visual. So it's actually a nice timeline built by Phil Robinson.
I think Terrence Mann was a real person. Like, if it's very clear that all the baseball players are not real, but like Terrence Mann, I don't have a tough time figured that out.
Right. There's a series, and this isn't coming from me, it's, I know, somebody who geeked out on YouTube, that shows that he's probably not real. And it has everything to do with the way Ray initially tries to, or pulls away from the apartment, believing that man has told him no. Showing that, and if you actually freeze the frames, that you actually lose sight of him for a second. And then the amount of time it takes for him to make that K turn would not have given man enough time to have left and then come back, because he's standing right now. So again, a little bit of a conspiracy theory, but one certainly that would go to support your observation that maybe Terrence Mann is a product of Ray's mind.
I thought that by the end, but like throughout the movie, I really like, for a while, I was like, well, maybe it's really real.
But do you think Moonlight Graham is real?
I mean. In the past, but like, no, that's part of his like. Hallucination.
Anybody think Moonlight Graham is real? Yeah. Okay. I don't know. I mean, if the ball players aren't real and if Moonlight Graham isn't real, boy, I mean, to have Terrence Mann in the middle saying, oh, but he is real, that just, it feels, I don't know.
But I guess like what's real and what's not is depending on the time, because there's like this idea of like time travel that's prevalent throughout the like film, and it's like, yeah, we know that Graham died like in the past, but then they picked up, I guess, the younger version, right? It's the younger version of Graham in what is supposed to be the present. So I guess your perception of whether or not Graham is real is dependent on which time you're looking at. I don't know how to explain.
No, you're right. You're right. And then that does parallel the ghosts on the baseball field too.
Right.
And the outlier would be Terrence Mann, because unless I miss something, he is still alive in
Right,
present day. And of course, Ray meets him in present day. So that does make sense. And if there is an outlier, it would be Terrence Mann. You can make that argument easily. Yeah. Mhm. And then that's why I don't know. Yeah. I mean, the way to, I think, figure this out for, individually would be to rewatch with that very, very specific point in mind to check out everything in terms of vetting whether or not Terrence Mann is real. Other thoughts here? Field of Dreams. So there's actually evidence to support that this is bipolar. That's certainly not in the plot, but just a little bit of a closer inspection here. We have a person, a middle-aged Caucasian male, who hears a voice, appears to perhaps have a past psychiatric history significant for having had a manic episode, hallmarked by irritability. And after the scene where he sees a physician and a referral to a psychiatrist is discussed, he's asymptomatic until the following spring, right? So, I mean, putting two and two together, why wouldn't that family practitioner have gone through with the referral? And does, or is his having been asymptomatic suggestive of his having been placed on a medication? And if that's the case, again, you're not going to find this in the script. What 3 classes of medication would that psychiatrist consider to place Ray Kinsella on? Antipsychotic. So chlorpromazine, which is a first-generation antipsychotic, does have FDA approval for the treatment of mania. And then there are several second-generation or atypical antipsychotics that also have that FDA approval. Right. So certainly antipsychotics. 2 more. Mood stabilizers, more specifically what? Lithium. Right. So we're going to say lithium as the gold standard for mood stabilizer. And then 3rd class. So the anti-epileptic drugs, good, with valproic acid and carbamazepine being common examples. All right. What would you have put them on and why? So again, we're talking now, we're back to the fall, and you're the psychiatrist to whom the primary care physician has referred the case of Ray Kinsella too. Ray tells you exactly what happened, AKA the first 17 minutes of this movie. And you're going to provide pharmacotherapy. What medications are you going to choose for this person who is an active mania? So you have an antipsychotic, right?
Or lithium.
Let's say and or lithium, right? If you look at the different treatment algorithms, this is probably going to take 2 medications, one of which really should be the antipsychotic due to there being evidence of auditory hallucinations, right? So maybe the lithium antipsychotic regimen or the anti-epileptic drug antipsychotic combination, but he should be on 2.
And I think, if we're doing like a very practical approach to this, if he's living in like a farm land, let's say lithium does need to be monitored with like blood work, so maybe, I don't know, like if it's too difficult for them to get monitored frequently, like those kind of considerations can play a role in the
Well,
initial.
for proic acid needs routine lab monitors too, though. Yeah.
And for the LSDs, if he's got a history of, like, just anything.
Yep.
That's fair.
When we look at what happens in the spring, I think there's evidence to again support the idea that it's lithium that's chosen. With no evidence that antipsychotic was part of the regimen, despite the fact that one should have been. And I'm focusing now on when they're in the kitchen. And Karen is yelling for her father, who is in the middle of a discussion about the family finances, AKA significant stress. And Karen calls her dad to the door, and in addition to the auditory hallucination, he is now experiencing visual hallucinations. This seeing the ghosts, specifically of Shoeless Joe Jackson, is the first event that we know of since what happened to him in the fall. So after a period of several months of being asymptomatic, he is now symptomatic again. Right? When he begins talking to the ghost, what is done next in that scene? What does his wife do? And why is what his wife does important to know when it comes to our arriving at the idea that he actually is on lithium now? No? She puts on another pot of coffee. She puts on another pot of coffee, right? And there's evidence that he's drinking coffee throughout this movie. And I'll actually post on Instagram the very script and a picture of him drinking coffee, because caffeine and coffee will lower lithium levels. Right. So despite the fact that he was referred to a psychiatrist and due to a sustained period of sobriety on lithium therapy, he's once again symptomatic. It's because of increased coffee intake. That may in fact be due or consistent with his increase in stress levels. Right. Now, if the lithium is lowered, there might be evidence of his having been on another medication that now has an unmodulated effect. Right. So again, if you're on dual therapy and the lithium levels are subtherapeutic, you're now on monotherapy. And there's an FDA-approved medication for mania, which he might be on. It has a black box warning of increased suicidal thoughts. What medication is that treats bipolar? You can FDA-approved medication to treat bipolar, one that we already named, that actually has a warning of increased suicidal thoughts. Lithium actually decreases suicidal thoughts, and it actually is anti-suicidal in the medical, per the empirical literature. So valproic acid. Right. So, way back in the fall, when he sees a psychiatrist, they forget to put him on the antipsychotic, which Robert Wood Johnson medical students would have put him on. And in addition to lithium, put him on valproic acid. Follow up now in this fast forward to the spring. He's symptomatic again, largely due to the lithium becoming subtherapeutic due to the caffeine interaction, unmodulated valproic acid. And maybe this movie is in fact about a near-death experience after all. due to the black box warning of valproic acid for increased suicidal thoughts. And so, not only is Field of Dreams, I think, an incredible movie to watch, period, especially this time of year, but it is also one that I think does a wonderful job in depicting and therefore allowing us to discuss mood disorders, including bipolar. But also, I think reading the script closely, there's also evidence that pharmacotherapy and a discussion on the basic psychopharmacology of bipolar, I think is also in play here. So let's talk a little bit about lithium. Now let's talk a little bit about valproic acid in terms of their role here. Maybe not for Ray, but in general, right? So lithium therapy, again, is FDA approved for acute mania. It's also FDA approved for maintenance therapy, meaning that between episodes to maintain an individual on lithium. And while it does not have FDA approval, it is indicated per the American Psychiatric Association treatment guidelines for depression in bipolar. So the reason why it doesn't have that indication is because it's off-label. We mentioned before, there are baseline labs we have to consider when we start people on lithium therapy. That includes a beta-HCG. Why?
That's
The Epstein's anomaly, right? So it's teratogenic, especially in the first trimester, about 1 to 2%, but there is risk. After the beta-HCG, again, counseling about birth control and the risks of becoming pregnant. We also get a comprehensive metabolic panel, especially focused on the BUN and creatinine. We also get a sensitive TSH, right, because of hypothyroidism or lithium-induced hypothyroidism. So those are the primary labs. We get a lithium level at day 5. Generally speaking, blood levels are obtained with 5 half-lives. So half-life of lithium, 24 hours. Even I could do that math, day 5. And then every 3 to 4 months, repeat the lithium level. If they had done that, they probably would have found that Ray was subtherapeutic before he sees the ghost of Shoeless Joe. But nonetheless, every 3 to 4 months, in addition to beta-HCG lithium level, you can repeat the BUN, creatinine, and TSH. Annually, we also consider a calcium. Lithium can actually induce hypercalcemia as well. Yeah. Or it might even unmask an occult parathyroid tumor. Yeah. Know the signs and symptoms of lithium toxicity. So delirium, polyuria, impaired gait is a triad. And symptomatic lithium toxicity always gets hemodialysis, right? Favorite board question. So in 1 week, hemodialysis is your single best answer. Valproic acid, anti-epileptic drug. Beta-HCG at baseline. Why?
Oh, no,
Neural tube, right? Again, teratogenic, neural tube defects, which probably are not going to be, that is, the risk is not going to be mitigated with folic acid supplementation. So the risk here is tenfold in terms of comparing it to lithium. So it's about 10%. So it's significant. In addition to the beta-HCG, many prescribers do get a valproic acid level, 50 to 100 or 50 to 150. However, if the level comes back either subtherapeutic or in the toxic range, there's nothing to do. If your patient is asymptomatic, that is, if it actually improves the manic symptoms and it is subtherapeutic, you leave the dose where it's at. And similarly, or conversely, if the patient is improved with no evidence of side effect and they're in the 100 to 150 range, there's still nothing to do. So if that's the case, and if you're a conservative physician, you may not even opt to get the lithium level. And then every 3 to 4 months, you could consider a beta-HCG, as well as liver function tests, primarily an AST and ALT, as well as a platelet count. Patient complains of abdominal pain, especially one pain that is in the epigastric region that radiates to the back. Please get an amylase on that place, lipase as well, but we don't routinely screen for pancreatitis. Lithium, take it back. Valproic acid toxicity is hallmarked by nystagmus, slurred speech, impaired gait. So individual looks like they're intoxicated, including the nystagmus. Questions about lithium or valproic acid? Valproic acid, similar indication, maintenance therapy in between episodes, as well as for acute mania. One other, not that it plays any role in this movie, but one other mention, because anytime you mention the treatment of bipolar and you talk about the pharmacotherapy for bipolar, we should talk about electroconvulsive therapy, because that is the first line treatment. Right, so for individuals, especially during the depressed phase of bipolar, when antidepressant use can actually initiate a manic episode, the role of ECT should actually be strongly considered and discussed with your patient. Generally speaking, the management of somebody with bipolar biopsychosocial, focusing on the bio or somatic treatments, would be to optimize the mood stabilizers and to avoid potential mood destabilizing agents. So certainly you have to aggressively address any co-occurring substance use disorder. And then the other culprit here, the big time culprit with regard to a mood destabilizing agent, antidepressant. So be very, very careful. And most studies that have demonstrated the safety of antidepressants are short-term, and their outcome and what they track, the metric, is the initiation of mania. But there's another untoward outcome as well. What is that?
Waiting.
No? Well, yes, but no.
Is it in younger patients?
No. It's usually in older patients. No. Specifically for individuals stricken with bipolar who are provided antidepressants over a number of years, a cumulative dose effect, older patients. Rapid cycling variant. Right, there are multiple risk factors for rapid cycling. That is 4 or more episodes within 12 months. One is antidepressant cumulative dose. Right, so you might be starting an antidepressant and you might be very vigilant when it comes to the initiation of mania. But after several years of treating your patient, you will still have increased their risk of rapid cycling. Right, and that's a treatment resistant variant.
So it goes from you're taking antidepressants straight into rapid cycling, or like the antidepressant precipitates like bipolar disorder and then like later on in life rapid cycling?
Oh, no, I mean, talk about individuals like Ray who have established bipolar
Oh, okay.
and now are presenting to you in the depressed phase.
Okay.
You might start the antidepressant thinking, listen, our goal is to get you over this depressive episode, and you might be right. Hopefully you've discussed the role of ECT, but again, you might be right. But when you do that over decades, what you've done, even if you've avoided initiating a manic episode during any of those antidepressant trials, is increase the risk of rapid cycling in your patient. Okay, antidepressant cumulative dose. Other thoughts? Final thoughts, questions? We're good. Okay, we'll leave it here. We will not be posting anything for next week, as you guys don't want to talk about a movie. You'd be too busy. So good luck on your exam, and we'll cut it off here.